Advanced wound care is needed particularly in wounds that are having difficulty coming to closure. Chronic wounds, wounds that such as diabetic foot ulcers, pressure ulcers, venous stasis ulcers. We use a variety of treatment modalities to take care of wounds. Most simply, we will use removal of dead tissue through debridement of the wounds. We'll use topical dressings to include collagen and antimicrobial based dressings. To control the leg swelling, we will use gradient compression wraps. And ultimately, some of the more difficult wounds that qualify, we will use hyperbaric oxygen therapy, which is the delivery of oxygen under pressure to our patients. It involves placing the entire person inside of an acrylic chamber that is pressurized to, most of our patients, twice atmospheric pressure. That's like diving to the bottom of the swimming pool at about 33 feet. Many of the wounds that we take care of are what we call limb-threatening. Bad diabetic foot ulcer, which at first may seem quite inconsequential, can very rapidly become infected due to continued pressure, walking, repeated trauma, can very quickly come out of control and result in more pain, more suffering, loss of a toe, a foot, or a leg. A diabetic should always take a foot wound seriously because a very minor wound that might be completely inconsequential for a young, healthy person can be limb-threatening for an older person, particularly someone with diabetes or peripheral artery disease or neuropathy or any number of other conditions that will keep them from the normal healing process.